My name is Charlie Preston, and I'm a resident in preventive medicine at Johns Hopkins, and I'm here today to talk just a little bit about how incredibly important funding for preventive medicine residency training is. We need more physicians who are trained in public health and in population medicine, and that's what preventive medicine residency training does. Traditionally, funding for preventive medicine residencies has been much lower than the funding for other residency specialties. And what that means is that the salaries of preventive medicine residents are much lower than the salaries of residents in other fields. We need a living wage just like they do. Another reason that funding for preventive medicine residency training is important is that it pays for the academic portion of our public health training. At Hopkins, we get an MPH degree, and that costs about $60,000 for the year. There is no way that I would have been able to pay for that degree on my own. I have $250,000 worth of debt. Another reason that preventive medicine residency funding is important is that it pays for part of our practicum training, and that's where we go to local public health departments or federal agencies or nonprofits and do training in that particular setting. If we have more support from the residency via increased funding, we don't have to ask the site for that funding. And in these tight budgetary times, that's a good thing. On a personal note, funding for preventive medicine residency training has enabled me to pursue my dreams, which are at the intersection of medicine and public health.